colonoscopies are not a new topic for us, but the fact that they're being recommended more often by endoscopists than the recommended guidelines is something to be aware of. Now, you may think that your doctor is being extra careful to rule out colon cancer in your best interest, but often the conflict of interest can ignore the risks that are not just from the anesthesia, but from perforations and or bleeding.
Yeah, enough to put you in the hospital, so it's not like it's a small thing. Now, about 1 in 200 people who have a screening colonoscopy will have a benefit from that because we'll find something like a polyp that is a premalignant polyp or a colon cancer. And about 1 in 200 people will also have a perforation or a GI bleed that requires being hospitalized, transfused, and until you're better. So those are numbers that are kind of impressive. The other thing is if you have a normal vitamin D level and you're fit, your chances for developing a colon cancer go to something more like 1 in 400 or 1 in 500. In that case, is a screening colonoscopy really a good idea?
Yeah, again, here we go with lifestyle is better in prevention than early detection.
Absolutely.
And all this extra money that's spent on the colonoscopies is raising our healthcare rates besides.
Well, for sure. So a study was done that was published in September of 2014 in the Journal of General Internal Medicine. And they said that screening was done too early. And they know that the recommended interval is about 10 years, unless there's a precancerous.
Starting at 50, I guess.
Starting at age 50, yeah, if there's a precancerous adenoma that's found. And they followed like almost 1,500 people aged 50 to 65 for about 10 years. And they found that 800, almost 900 people were retested an average of 6 years later. And these were people that didn't have precancerous tumors.
So 49% of the follow-up colonoscopies were done too early.
Right. So it's understandable. I mean, doctors do want to stay on top of things. And a lot of doctors feel that more prevention or more early detection is a good idea. That's not the standard of care. Fact is, you could question whether or not colonoscopy should be done at all as a routine screening procedure. Now,
so in other words, a person maybe should wait for symptoms of a problem?
Wait until you have a symptom. That certainly would be one thing.
So let's talk about what maybe the symptoms would be, like blood in your stool.
Oh, that certainly would be one. But things like being bloated or distended or gassy, if you have signs of colitis of some kind, that would be something, or abdominal pain that you can't explain. Those are all good indications to do a colonoscopy, and we save a lot of lives that way, Vicki. But to do a screening test and do it more often than is recommended is going to lead to more complications and problems, according to this data that we have.
Of course, then a lot of people are afraid that it might be too late.
Well, it might be, but not often enough to make it worthwhile. There are always going to be cases, your gastroenterologist is always going to have a case and say, damn, we should have done that colonoscopy because we could have saved this person's life if we had done it a year or two ago. You hear stories about that. But you don't often hear them saying, damn, we have a perforation, or darn, we got a problem with a GI bleed. Those are things that happen because it's what happens with the test as something that's expected every now and then.
So just because you've had your 50th birthday, does that mean that you need to go right out and have a colonoscopy?
Well, I haven't yet, nor have you. I'm fit, and my vitamin D levels are good, and I'm going to count on that. Now, more often than not, I'm going to be right. It's always a statistical thing. You pay your nickel and take your chances. And once in a while, you're going to get burned. But I'd rather get burned that way than overdoing it. And that's the problem.
And we have a lot of other videos on our website, drsaputo.com, on this particular topic. So if you're interested in researching it further, go for it.
It's there. Yeah, the United States Preventive Services Task Force has done a lot of work to present this information, and we reported it. I think you ought to take a look at it. You probably learned something.